Hello, everyone. Welcome to Cancer and Crisis Talks on OncoDaily. I'm Jemma Arakelyan, the CEO of the Institute of Cancer and Crisis. And today we are going to delve into the critical issues surrounding cancer patients in Iraq, together with Dr. Mula-Hussain. Hello, Dr. Mula-Hussain.
Hello, Jemma.
Dr. Hussain is a highly accomplished physician and researcher in the field of radiation oncology. Originally from Iraq, he obtained his medical degree from the University of Mosul and completed his residency in radiation oncology at the King Hussein Cancer Center in Jordan. He further pursued an MSc in advanced oncology at Ulm University in Germany and gained extensive clinical experience through fellowships in Canada. Dr. Mula-Hussain has held prominent positions at various cancer centers globally and is currently serving as an attending physician at the Cape Breton Cancer Center in Canada. He is also actively involved in academia as an assistant professor at Dalhousie University and a visiting professor at Nineveh University. Let's start our conversation today with giving some epidemiological data. So, what are the most prevalent types of cancer in Iraq and why do they present challenges?
So the most prevalent cancer in Iraq, as in many other countries, is the breast cancer in ladies and the lung cancer and colorectal cancer in males. There's also something interesting to mention is the relatively high incidence of CNS tumors and blood cancers, leukemias in Iraq, which is relatively not common in other communities.
Exactly. Are there any reasons for that? For instance, CNS tumors, they are really rare.
Yes, so CNS tumors, um, like in other communities, is not that common. Usually, it is not among the top 10 cancers, while in Iraq, it is among the top 5 cancers, and it
Okay.
increased in incidence and after the wars. So might be there is a correlation between the war pollutions and the incidence of the CNS and leukemia, but this needs to be verified in other well-structured studies. But this our observation from the data of the Iraqi Cancer Registry before 1998 and till the most recent, there was a rise after 2003, and now it turned back to around rank number 5, while after 2003, it jumped to rank number 3.
I see. So, what are the main challenges faced in delivering cancer care in Iraq?
The challenges in delivering cancer care in Iraq are many actually, and some of the challenges uh, related to the overall unstable life circumstances that Iraq passed through in the last 4 decades. Like Iraq started the 1980s, although at that time there was good progression in the healthcare system in general, but Iraq passed through 8 years war with Iran. After 1990, Iraq passed through embargo and sanctions for 13 years after the war in Kuwait in 1990 till 2003. And from 2003, Iraq passed through with another war. There was change of the government and regime, and then unstable security, life circumstances, terrorism, attack by ISIS between 2014 till 2017. So in the last 4 decades, Iraq passed through many difficult challenges. Part of these unstable life circumstances impacted the healthcare sector in general and the cancer care in particular. So I can say that the challenges could related to the overall political situation of the country. The other thing is the relatively high expenses of the cancer care treatments, whether it is systemic treatments or radiation therapy machines. The manpower also, um, like when I started in 2002 to be a resident in oncology, at that time there were just a few numbers of residents and of specialists across the whole country. We used to have only two centers of radiotherapy, one in Mosul and one in Baghdad, with very limited number of machines across the whole country, around like handful machines um, of machines of radiation therapy. Um, so the manpower, the expertise. After 2012, there were development of uh, specialty programs in medical oncology and in radiation oncology, and also in surgical oncology. Now the situation is better.
Mhm.
Uh, Still, we have problems with multidisciplinary concepts. We don't have a multidisciplinary comprehensive cancer tertiary center, unfortunately, till now.
Mhm.
I have to mention that before the war in 2003, there was a project to establish a comprehensive cancer center signed and approved by the Ministry of Health in 2002. But that project halted and didn't progress till now. So these are the challenges that I can mention: the political life, the um, unstable security, the corruption, and the human resources, and the absence of the multidisciplinary oncology care and the comprehensive setup. Um, there are some trials here and there between many centers and across the Iraqi provinces, but it's more as an individualized treatment plans, not a multidisciplinary as we have in other like well-established comprehensive cancer centers.
Sorry, did I understand correctly? You have clinical trials currently in Iraq?
So we don't have interventional clinical trials,
Mm.
unfortunately. Part of the problem is the recognition of the international uh, clinical trials group. And the other part is
Mm.
the community. The Iraqi people are not well interested to be in clinical trials.
Mm.
I work there, and many of my patients, they are not willing to be part of the study, part of the trial. They are willing to have the standard treatment. I remember one day I mentioned the clinical trial, and they told me, "Oh, we don't like to be managed as a pig
Mm.
because the people they think that the trials is for the animals, not for the humans. Give them the standard of care, not to give them the clinical trial arm." So there are some trials, like efforts to make it, but it is not well established, and we don't have like a well-known established authority that can manage and control the clinical trials in the country.
I see. But at least you are trying and
Yes, there
yeah.
are some trials, some efforts. I have to mention this. My colleagues and also me, we started some efforts, but it is not that international landscape or multicentral or well-funded, because we are
Yeah.
like not funded by any authority. Like I tried to establish a certain fractionation protocol in breast cancer ladies.
Mm-hmm.
And so it was just not funded by any authority. So I got the approval from IRB, for example, and we did
Mhm.
the trial. We copied the trial from a British trial, but to make a trial from the uh, like a genuine Iraqi trial, I am not aware.
So, from this conversation, my next question is coming. How has the Iraqi government attempt to address this kind of challenges in cancer care delivery and management?
It's interesting that today, October 5th, is the launch of the first Iraqi Cancer Board Congress in Baghdad.
Mm.
It's chaired by the Minister of Health and my colleague, Dr. Tahsin al-Rubai. He's the director, he's the general secretary of the Iraqi Cancer Board. So today and tomorrow, many Iraqi stakeholders in cancer care and policy with other colleagues from other countries like Dr. Asim Mansour. He's the Director General of King Hussein Cancer Center in Jordan. He's also in this Congress, and many other people also in this Congress. We all feel about this issue, the cancer burden on the Iraqi patients, and we want all together to improve the situation. So the
Okay.
ministry is working, the
Mhm.
Ministry of Higher Education is working also, and the private sectors also trying to help. The non-governmental efforts, also organizations and societies, they are trying to help. And there are good examples now in Iraq. We achieved many steps of improvement.
Like, are there any screening programs currently in Iraq for
So
breast
for this,
cancer,
for
colorectal?
this, yes, for the screening program on national base, like obligatory
Mhm.
one, we don't
Yeah.
have this such a program. We have centers for breast mammogram.
Mhm.
They, I mean, it is not obligatory, and the patient and the people will not get like notification that now you are 40-year-old or 45-year-old and you
Time
need
for screening. Yeah.
to time for screening. No, we don't have such
Mm.
a program, but the centers are available. The breast physicians can send the patient for the uh, screening mammogram. Some patients can go to the private mammogram and do the
Mhm.
screening by themselves, but we don't have a national program, whether
I
for
see.
breast, whether for prostate, whether for lung, low-dose CT scan, or for the cervical cancer, or for the colon cancer. So these are the common 5 cancers that can be screened. And also in Japan, there is a screening program for stomach,
Gastric. Yeah.
but
Gastric cancer. Yeah.
we don't have that high incidence. So, we to be the bottom line that we don't have a national screening program.
Like in many other countries,
Yes,
unfortunately.
yes.
So, what role have international collaborations and partnerships played in improving cancer care in Iraq? Because I know that you have some collaborations with International Atomic Energy Agency and how they contributed to enhancing cancer services in Iraq.
Yes. So the International Atomic Energy Agency visited Iraq last year through
Mhm.
the mission of IMPACT. IMPACT is the integrated mission for the program in cancer therapy. Um, they are like addressing the issues of the cancer care services, and after that submit a report to the Iraqi government, Ministry of Health in particular. And then the Ministry of Health will try to follow the recommendation by this international authority. I remember that they did this visit in 2021, and I think they released the report in 2022. And yes, from my side, I was part of the impact mission in two countries, in Pakistan in 2013 and in Syria in 2022. And we also like addressed the challenges and the steps that need to be addressed by other countries in order to improve the cancer care. But for Iraq, I was not part of the impact mission, maybe because of the conflict of interest, because I am an Iraqi.
Yes. Yeah,
So this
exactly.
the experts in that visit were from other countries.
Can you tell us more about advanced radiation oncology program?
Okay, so in Iraq, the radiation oncology services started in 1960s by establishing the Institute of Nuclear Medicine and Oncology in Baghdad. And then in 1970s, the other institute in Mosul was established. Um, in 1980s, the first training program for specialization was by the Ministry of Higher Education at the University of Baghdad. And it was composed of 2 years of training diploma
Okay.
program called DMRT.
Mhm.
When I entered the field of oncology in 2002, after about 20 years from that launch of a program, I tried myself to be a student in this program. When I went to Baghdad, uh, I discovered that it is not recognized as an academic degree, and I was working at the University of Mosul. And then I decided to look around for other higher specialization program. So I decided to travel, and I was accepted in Jordan at the King Hussein Cancer Center for 4 years program, rather than only 2 years program. And after finishing that program, I decided to transfer the experience from that well-established program to my country. Um, After the board, I did Master of Science in Germany in Advanced Oncology, and I did 1 year of fellowship in Canada. I returned back to Iraq and with a dream to establish an advanced board certification program. And with the help of other people, Alhamdulillah, we achieved this initiation by uh, April 2013. And the first students entered the program by July 2013. And it was a 4 years program recognized by the Kurdistan Board for Medical Specialties. And at the end of 4 years, in 2017, the a new um, specialist became certified. The interesting thing that in 2017, I organized that my residents to be evaluated by the American College of Radiology in their in training exam called radiation oncology in training exam, in order to see their level compared to the residents in the United States and Canada. And 7 of my residents entered that exam. The top one achieved higher mean than the colleagues in the than his peers in the states. So I was proud of this
Yeah.
like a program, and we achieved many like visitors. We invited many visitors during
Mhm.
these 4 years from the States, from Italy, from UK, from Canada, from Jordan. They came and gave lectures, presentations. We arranged the best of Astro in 2015. At that time was first officially licensed by the Astro Society in the Middle East. And So during this time, we established the first board certification program in Iraq. Baghdad followed us in 2020, and next year uh, they will graduate their first batch in 2024. It's also 4 years of program. Uh, at the center that the training center was the Gianawa Cancer Center in Sulaimaniya city in northern Iraq, Kurdistan. So I'm like happy to share this experience with all the global audience. And we published this experience, the challenges. After this successful story, also we published a book, uh, and the name of the book is The Global Portfolio in Certification. So it's kind of an effort that can be used as a roadmap for the trainers and the trainees for their future radiation oncology certification.
That's a great achievement.
Thank you.
Congratulations.
Thank you.
So this story is really amazing, and I want to ask you if this program, the Advanced Radiation Oncology program, motivated young specialists in the field of oncology to become radiation oncologists and then to get deeper into this field.
Yes, thank you for this question. Yes, I can say yes, it improved the um, enthusiasm of the young medical generations to enter the field of oncology in general and radiation oncology in particular. The same also done for other programs, like if you have good examples of success, if you have like good people who achieve the milestones, then the young generations will follow because they feel that they will continue this successful mission and they will be part uh, of the like people who are making the successful achievement. So yes, it improved, and now the number of the radiation oncologists in Iraq increased um, in many times if you compare it with the time when I entered the field of oncology in 2002.
So you addressed one of the main challenges that you mentioned.
Yes,
Okay, so my last question is what are the existing gaps in Iraqi healthcare currently?
financial toxicity, especially that many regions in Iraq have no radiotherapy services and they need to travel on their own expenses to another
Mm.
place, whether another city or even to outside of the country to get the treatment. And I mentioned this in my paper last year about war and oncology. Imagine all the provinces that were under some control of ISIS or complete control of ISIS, Nineveh, Tikrit, and Kirkuk, and Diyala, and Anbar. All these provinces have no any radiation services since many years. And combined, this land is over 50% of the Iraqi land, and the population over quarter of the Iraqi population. And they need to travel um, uh, like either hundreds of kilometers or even abroad in order to have the radiation services. So they are suffering, and this is a financial
Mm.
toxicity. This is beside inavailability of many recommended cytotoxic or other systemic treatments like immunotherapy, biological therapies. Um, so there are uh, like obvious gap in the availability of the
Mm.
recommended medications according to the international standards and guidelines.
think you mentioned about immunotherapy and other types of systemic therapies. Are these kind of therapies covered by the government or not at
There are
all?
some, provided by the government for free.
Mm-hmm.
Any medication usually provided by the Ministry of Health in Iraq is free for cancer patients.
Mm-hmm.
Even the expensive medications like Herceptin or
Mm-hmm.
Keytruda or other medications, they are sometimes available for free. Um, Also, the radiation treatment, if it is available, it is for free. Some private centers now also started to work in Iraq, and they are like working, and because there is a long queue wait on the governmental
Government, yeah.
machines. Uh, so despite that the government is providing the part of the care, still the patients need to pay from their own pocket. We don't
Mhm.
have a well-established insurance companies that can pay for the patients. So usually the patients and their families will pay by their own pocket.
So once again, thanks a lot, Dr. Mula-Hussain, for joining us today. This conversation was really very, very motivating for other specialists in the area and also very informative. Thanks a lot for joining us.
Thank you for having me in this conversation. Have a good day.